What is flatulence? Gas passes through the anus as normal, and every human being does it at least 14 times in one day, consciously or unconsciously. Sometimes the belly wind runs out more than expected. Intestinal gas usually comes from two sources, one air swallowed, the other the work of gut bacteria on undigested food. Bloating of the nervous stomach. Sometimes a person develops flatulence without consuming any of the bloating or even when he has not eaten much food. In such situations, too much anxiety and stress may cause such a complication. When this type of bloating is associated with other warning signs such as hiccups or other diseases, it can indicate a serious condition such as irritable bowel syndrome. Flatulence and shortness of breath. Since flatulence causes pressure to enter the diaphragm, it causes shortness of breath in certain situations. Short, stop breathing or hiccups are symptoms of flatulence and shortness of breath. Because during flatulence, the diaphragm has less space to open and close. If these conditions dominate the body for a considerable period of time, the amount of oxygen required for the body decreases and the person suffers from anxiety, palpitations, acute shortness of breath, balance problems, and so on. Reasons for belly bloating. Eat fast. Eating too much. Antibiotic use. Talking and laughing between food that leads to swallowing air with food. Consumption of drinks with straw. High vegetable consumption in raw form, broccoli, lettuce. Consumption of packaged and semi-prepared foods. Consumption of canned foods. Consumption of carbonated beverages such as soft drinks. Consume water and other drinks when eating. Chewing gum. Eating garlic and beans. Food consumption shortly from bedtime. Lactase deficiency for lactose digestion or the same natural sugar in dairy products. Constipation. Intestinal problems such as irritable bowel syndrome. Low fiber food consumption. Fructose are natural sugars that are available in fruits. A type of bacteria in the gastrointestinal tract that causes stomach ulcers if left untreated. Stress and anxiety. Smoking. Weight gain. Menstruation of women. Consumption of potatoes, wheat. Prevention of flatulence. Note: each person's body is different from the other person's, and not everyone has bloating just by taking a particular type of substance. A specific nutrient may cause flatulence in one person's body, but it does not cause such a condition in another person's body. Excessive consumption of wet foods and foods such as cucumbers, squash and so on can cause bloating. Also, if your stomach and intestines are prone to bloating, avoid excessive consumption of legumes, especially chickpeas, lentils and beans. Pickles, ice water, garlic cause flatulence. Having regular exercise on a daily basis. No smoking. No consumption of alcoholic beverages. No consumption of soft drinks. No consumption of beans without soaking them. Consumption of ginger, mint leaves and parsley. No consumption of corn, onion. Immediate and traditional treatment. Angelica. Pour 3 spoons of Angelica into the teapot and add boiling water to allow it to remain on heat for 10 to 15 minutes and then eat it. Massage at the end. Do you need to see a doctor for treatment of belly bloating? If you notice the following symptoms, it is advising to see a gastroenterologist. Diarrhea over 5 days. Sudden weight loss. Abdominal pain. Blood in the stool. Decreased appetite. Fever. Golden tips. Eat slowly. Don't sleep after eating. Chew more food. Don't eat too much water and liquids when eating. Do not take vitamin supplements before bedtime. Reduce your stress. Exercise daily. Don't eat 2 hours before bedtime. Drink 8 glasses of water a day. Drink pineapple juice and coconut water. Eat healthy foods. Drink mint sweat. Eat asparagus and celery. Take probiotics. Take chamomile tea, ginger tea, fennel tea. Place a hot water bag on the abdomen.